Hi, I'm Dr. Nicky Kirk of Nueva Vida Chiropracticos in Dorado, Puerto Rico, and today I'm here to talk a little bit about the condition fibromyalgia. So over the next minute or two here, I'm just going to be explaining what the contemporary understanding of fibromyalgia is, because one of the things that we feel like is that a lot of people are maybe not up to date with the current literature, current understanding of fibromyalgia, and therefore aren't getting the help and assistance that they need to enjoy a better quality of life. Traditionally, fibromyalgia has been treated as a diagnosis of elimination. That's to say that people have presented to the doctor with discomfort, with pain, and after they've gone through all of these tests and through all of these different specialists and nobody's found anything wrong with them, therefore they must have fibromyalgia based on the fact that they have certain predetermined areas on the body which are tender when they're pushed. We now know that fibromyalgia is not a psychological condition. Its pathophysiological basis is pretty well understood. So I just want to run through some of the key facts about fibromyalgia and some potential ways in which one might help oneself if they're experiencing fibromyalgia or think they might be, and take things forward from there. For anybody who does not understand what fibromyalgia is or what people experience with fibromyalgia, it's a condition which is part of a very large continuum. So for some people, symptoms can be fairly mild and come and go. The challenge is that the symptoms can be fairly non-specific and can affect multiple systems in the body. So somebody with fibromyalgia may experience headaches, they may experience nausea, they may experience gastric or stomach upsets on a regular basis. They may find that they get extreme or really chronic fatigue. They may find that the concentration can be affected. Sometimes it can create headache with aura, can mimic migraine, and often it's going to affect their work life, their social life, their family life, and really can be quite debilitating. Often these people won't be able to get enough sleep, they won't recover well, and it really can affect people over a long period of time in a way that can be really devastating. What we understand now about fibromyalgia is that it's has a phenomenon called pain centralization, and that's the final common pathway. We believe and we understand that the nervous system, or the way that the body, which is the way that the body interprets the world around them through our eyes, through touch, sight, smell, hearing, the nervous system becomes hyperactive, hyperstimulated. So what might be a normal stimulus or normal experience for a person who's not with fibromyalgia can be massively exaggerated. So an example I often give people is imagine that the nervous system is the volume in the stereo. So for a person who does not have fibromyalgia, the volume is set to 0. So if I come in and push, it doesn't really register. For people with fibromyalgia, the volume is set to 9. So a very small stimulation can create just a massive response, a massive reaction in the body. And that probably explains and that probably describes the experience of people on a day-to-day basis with fibromyalgia in a way that someone who doesn't have it really couldn't understand. The challenge is this: is a lot of the things that we know would help fibromyalgia in the long term are things which can provoke it and exacerbate it in the short term. So often these individuals, a person with fibromyalgia, they'll often be told to go and exercise. What we've seen from our patients and from experience is that patients who go and exercise or push it too much, it can often provoke the symptoms and create more fatigue, more pain, more discomfort, and obviously they're just not very functional the day afterwards. We feel that activity and being active is an important part of treatment, but it has to be monitored and it has to be guided and it has to be the right amount at the right time. Traditionally, what's been happening is that medications and a lot of drugs which just have no evidence for effect are prescribed. So in particular things like opioids, corticosteroids, non-steroidal anti-inflammatories, hypnotic drugs. There's really no basis of evidence for these types of medications in fibromyalgia treatment. And unfortunately, because they're often prescribed as a first line, that can create a lot of frustration for the patient, because they're taking these things, they have secondary effects, and they just don't work. They don't really do the business. There is evidence for stronger, more powerful drugs to help with fibromyalgia, but obviously there's a price to be paid for that, and the more strong a drug, the more possibility there's of a secondary interaction or a secondary effect. Obviously, I'm not here to advise on medication and how one should treat that. That's not my role. But I'm just here to draw attention to the fact that there are treatments for it. But as with everything, it has to be taken with a degree of caution and a degree of sensibility. In terms of a chiropractor's role in dealing with fibromyalgia, we like to think of ourselves as a doctor who treats the body's something which is, the sum is greater than the whole is greater than the sum of the parts, and we do look at it as a continuum. So first of all, since we know it's a reactive condition, we want to first of all calm the nervous system down. We know it's centrally mediated, so we want to calm down this activity of the central nervous system. And with that in mind, we have to look to the gut, to the digestive system, and make sure that that's not being provoked, that we're not taking on foods which may provoke some sort of allergic reaction, that we're really taking care of our gut and intrinsic health. There's some great strategies to do that. I mean, obviously one of the most straightforward is to introduce probiotics into the diet, as well as looking at foods which are maybe a little less inflammatory or require a little bit more work to break down. Number two, we need to make sure that the nervous system is not being overly stimulated. So we often will be thinking about electric devices, the blue frequency of light, which can stimulate the brain or overstimulate the brain, is obviously not going to allow for much relaxation time. We want to make sure that we're limiting that, especially towards nighttime with fibromyalgia patients. It may also be an idea to purchase some of those glasses which block that particular wavelength of light, which will obviously then decrease that stimulation, particularly at night before we go to sleep. We want to make sure more than ever that we have a specific routine so that we're able to get a good rest, good night's sleep, which is probably the most powerful recovery tool there is. And on top of that, antioxidants are things which can also mop up some of the more toxic free radicals and so forth, which can circulate in the body and can also create hyperactivity of the immune system. And as we mentioned before, fibromyalgia could be a product of autoimmunity, immune hyperreactivity, where the body attacks its own cells and can create some of those conditions. And finally, we want to make sure that the muscular and the nervous system are functioning as well as can possibly be. And that's one of the areas which we typically would work in the office with our patients, is we want to see how they're moving, see how things are working. And if we find any areas which have any interference or anything which is preventing them from having that optimal function, we can start to work with the body, work with the structure, so that the body's better equipped for the activities that they're going to be doing on a day-to-day basis. So those are some of the simple strategies and a little bit of contemporary understanding about the condition fibromyalgia. I just encourage you to reach out if you're in the local area. We're located in the Dorado Pueblo. If you're not close by but feel like you want more information or want to reach out and discuss it with one of the doctors, feel free to send us an email or contact us and we'll get back to you. And this is me saying have an active day, a healthy day, stay active, stay well, and I'll talk to you soon.